Thank you. Thank you, Mr. Leader and Senator Booker, and more importantly, thank you to each and every one of you who are spending your Sunday having these important conversations and standing up but also sitting down for the things that matter most in our communities. And Mr. Leader, you asked us to do a lot of town halls during the last recess. I had 12 town halls in the last 100 days. But this is my first sit-in, so it's really exciting. No, I just want to say, I know you've been talking about the importance of Medicaid all day, and we've been talking about it, Emily and I, as we're back in our districts these last 2 weeks, having those town halls, having those important conversations with folks. I know that you know the amount of children in this nation who've received their health coverage because of Medicaid. I know that you know that 62% of seniors in assisted living have health care because of Medicaid, because Medicare does not cover that. You know how essential it is, but I want to tell a story like Emily did about what we were able to achieve in Maryland when we expanded Medicaid. Now, we are not alone, even though we're in Maryland, one of the wealthiest states in the wealthiest nation, but we have a shameful secret, and that women are dying giving birth, and black and brown women at disproportionate levels dying giving birth. It's shameful in this nation. And we knew that, and so we did something about it in Maryland, and the best thing we did was expand Medicaid pre-birth, prenatal, but also post-natal, recognizing how essential prenatal, postnatal, early childhood health care is, not just to mother and baby in that moment, but to the lifetime of health outcomes for mother and child by that expansion. And so when our colleagues talk about, well, they don't really want to cut Medicaid, just want to get back to the basics, they're forgetting all of the advancements that we have made across this country, whether it was for Emily's sister or my constituents who are about to give birth. Those expansions are progress. Those expansions have saved countless lives in this nation. Now, I'm sure you all saw the news. The president wants us to have more babies, which is bonkers. But I don't know how he expects us to do that when we're not covering prenatal health care, when we're not covering postnatal health care or early childhood education or SNAP benefits or Head Start. And so thank you for being here today and giving voice to your neighbors. I know the senator and the leader have asked you for a couple of things today, how important your presence here is, but I'm also going to ask you something else, something I've been asking my constituents these last 2 weeks, which is I appreciate them coming out to a town hall. I appreciate y'all coming out here today, but we need to have conversations with people who don't always agree with us. I don't know about you, Easter was a little awkward for me. My parents voted for the president, so that was a fun Sunday dinner, but we were raised in this country to not talk about politics or religion at the dinner table. And I think that's left us in a place where we can't have the conversations about our community and our values that we need to have. And so I'm going to ask you to pick up the phone when you leave here and call somebody, a friend or a family member who lives in a district that doesn't look like yours and is represented by a member of Congress or a member of the Senate who doesn't vote the way that the folks here are voting. And just have that conversation about your values and your priorities and ask them to engage, because we cannot do this alone. We're 535 human beings. So you being here is exactly what our founders wanted. It's what they intended, that your voices be heard. And I'm so grateful to spend a little bit of my Sunday with all here. Thank you.